Have you ever experienced just that throbbing, excruciating pain in your ear from an earache? Or have you been a parent and woken up in the night and seen your child and they're just crying and they're pulling on their ears and they're all worked up because they're afraid and everyone's tired and everyone's stressed out and you need help right away? If you experienced anything like that, then you'll want to stick around, because today we're talking all about how to relieve earaches. And my name is Maria Chaudhary. I'm a midwife and an herbalist and the creator of Births on Botanicals. Let's just get this out of the way right away. This is an educational video. It's not intended to treat, diagnose, cure anything, but it is intended to remind you and validate you and help you in times like these when you're wondering what to do and you want to make the right choices, because actually earaches can be really serious, and if they're mismanaged and not tended to correctly, they can lead to long-term and permanent hearing loss in your children. So it's kind of a big deal. That's why we're sharing this video today. Right now we're in the thick of this whole cold and flu series. We started with making several videos about fever and how to treat fever with herbs and hydrotherapy. Then we worked into colds and coughs, upper respiratory infections, sinus infections, lung congestion. And we talked a lot about the herbs elderberry and thyme and decongestants and how to create steams and gargles. Really important. Those are also in the playlist. Also, I have an ebook, Herbs for Kids, and in that book, you can download it for free. There's also a course, and in that book we go over more detail about fevers and coughs and about earaches. So today is all about earaches, and earaches are real personal for me because I've experienced earaches a lot as a child. So I feel really like this is kind of my moral duty to talk to you about how important earaches can be and give you some real tools and some ways to manage them effectively. I'm gonna have a sip. So there are some studies that say that 95% of children age 0 to 6 years old will have at least one earache. 95%, that's a lot, and I'll believe it. And here's why. Because children are young. When they're young, they're developing and they're growing, and their ear canals are not completely formed. And when they're not completely formed, they don't drain well. And when they don't drain well, moisture gets trapped in there. Then eventually bacteria grows, and then eventually you have this earache. Like I said, they're really serious, and so you want to look for the first signs of an earache. And the first signs of earaches typically are a fever and sinus congestion, just a runny nose, a stuffy nose, a little cough, having that cough, and then when when an earache typically comes on, it's in the nighttime and they're pulling on their ears and they're crying, and those are the first signs of an earache, and those are signs that say that the earache needs to be treated and addressed immediately and appropriately. It's the time for you to go right to your herbs. It's the time for you to seek advice and counsel from a trusted healthcare provider or from your pediatrician. Let's talk a little bit about earaches and the types of earaches. So we have external earaches. It's called external otis media. And then we have middle earaches, middle otis media. And then we have serous or secretion or secretory earaches. It's also called ear glue. Pretty gross. I had that. I'll tell you more about it. So external earaches are, from the defining term is when you look at them, you'll see the eardrum and you'll see the moisture from the eardrum in the canal to the outside. So from the eardrum through the canal to the outside, that's external. And what happens there is moisture gets trapped in there and bacteria grows. And when you look, you'll see a bunch of discharge. They'll probably have a fever. It'll be red and irritated. They might have some congestion, but mainly it might have come from swimming and water got trapped in there. That's why this one is called the swimmer's ear. It'll be swollen and painful. And the way you can determine that it's swimmer's ear is when you pull on the earlobe, it's going to hurt worse. And the earache is going to be really throbbing earache. Okay. Then we have the middle ear. And so when you go into this middle ear, you can break things down a little bit. You have acute and then you have chronic. But the middle ear, the moisture and the infection and the problem is behind the eardrum. So when you look in and what you see for a middle ear infection, when you look at the eardrum, it's going to be red and it's going to be bulging, and or you're going to look in and you're going to see that it's been ruptured. If it's been ruptured, you'll probably see blood. You'll see bloody discharge. You'll see a lot of mucus. They'll definitely have a fever, and they'll have a bunch of congestion and pain, and they might also feel like dizzy, vertigo, have ringing in their ears, and have hearing loss. Acute infections usually follow the fever, and then they have the cough, and then they have the acute infection that's hot, comes on fast, and those are typically viral infections. And then you have chronic middle ear infections. Chronic middle ear infections, when you look inside the ear, you're going to see that bulging eardrum. You're going to see all those same things. You're going to have a lot of the same symptoms. But these are coming from, lack of a better word, the mismanagement or the poorly understood, the mismanagement of those acute ear infections. Since they were mismanaged, they start to become recurring, and then you still don't understand what's happening, and so it keeps happening again and again, so it starts to become chronic. But these chronic infections, especially when they're associated with a lot of discharge, those are typically bacterial infections. Chronic infections also come from bacteria, but they can also, the underlying cause are allergies, and most commonly food allergies. The most common food allergies are wheat, dairy, sugar, grain, corn, citrus fruits. And then you have this ear glue with all the secretions. This is thick, yellow, thick glue in the ear. And the difference is when you're looking into this ear, this is also a middle ear infection, but when you're looking into this ear, the eardrum, instead of it being bulging and red, it might still be red, but what's happening this time is it's sucked in. It's sucked in, and you can almost see maybe sometimes the malleus, incus, and stapes behind it. It's like being sucked in and adhered, and there's so much congestion in there that there's almost inevitably hearing loss. This is the type of infections that I had growing up, and I had multiple ear surgeries and tubes because we didn't understand the value and how important eliminating the underlying causative factor for ear infections, and so it was kept being mistreated or treated the same way over and over, and that didn't really work out. So underlying causes of ear infections in general are sometimes food allergies or viruses or bacteria, but also being in a home of smokers, being around a bunch of allergens like dust or wood smoke or pets. Those are the most common things that are going to cause all this mucus and all this congestion, and then that's going to lead to these earaches. Let's start talking about treatment. And before I get into treatment, I really want to talk about, just really quickly before we go into treatment, if you're experiencing yourself or your child's experiencing the ringing in your ears, the loss of hearing, blood in your ears, bloody discharge, an immense amount of pain, or a sudden relief of that pain, you probably just experienced a ruptured eardrum, and that you should seek medical care for that. And I'm also just going to say right here, right now, seek medical care. It's really important. And at the same time, most of the time, a ruptured eardrum can heal on its own, and it doesn't always result in permanent hearing loss and damage like it did in my case. So let's go into the treatments and the examination of the ears. I'm just going to talk you through how to examine an ear really quickly. So I really only do this with my child, so I'd have him lay down on my lap, and then you have to get really gentle. You have to be really gentle, and if they're laying down on a bed too, it'd be great. And you're going to pull and explore by lifting the ear and the earlobe, and so you can look and see. It's really nice if you have an otoscope. You can get one of those at Walgreens, really affordable, and has a pin light, and then you can focus in and see, or you can just use a flashlight and look in. When you're looking in the ear, remember, if you're pulling the lobe and it hurts worse, you already know that's an external ear infection. When you're looking in the ear, just observe and just use your powers of observation. What do I see? Is the eardrum bulging? Is it sucked in? Do I see blood? Do I see a perforation? Do I see, what color is the mucus? What do I see? That's all. Please do not stick a bunch of things down in there. Bobby pins, Q-tips, who knows what. Don't stick a bunch of things down in there. If you need to feel like you need to get a bunch of stuff out, let your care provider help you get the stuff out. So I want you to think about that. Also, I'm just checking my notes real quick because I knew there was something important I wanted to say. Oh, when you're checking hearing, this is important. So after you've looked to see what you see, you want to check and see if they can hear. So you can rub your fingers and your thumb together against their ear, and then check both sides, and then determine if they can hear. So that's what when you're doing an exam, that's what the exam is. Let's go into the treatments. The treatments, when you're treating an acute ear infection or a chronic ear infection, really in a lot of ways it's the same treatment. First and foremost, eliminate all the food allergens. If you don't know if your child has food allergies, get them tested. But eliminate immediately the food allergens. And then for an acute earache, all you're going to do differently is you're going to give more of the remedies. You're going to give all these remedies that I talk about more frequently in higher doses. For a chronic ear infection, you're going to keep with those remedies, but that whole food elimination diet, you're going to do that for at least 3 months. And you might include other really cleansing herbs to help get these toxins and get everything out and move through your system. And so you might include some cleavers in your tea to just help get all this stuff out of you. Okay, so when you have an ear infection, first thing, what are you going to do? Well, in terms of herbs, we're talking about herbal natural remedies. In terms of herbs, first thing you're going to do, you want to look immediately to your antibacterials and your antimicrobial herbs. Those are herbs like echinacea, Oregon grapefruit, and yarrow. Those would be great, especially if there's a fever involved. You want antimicrobial, antibacterial herbs, and you want to take them internally. You can do them with tinctures, like Children's Immune Boost is great for a fever and for antimicrobial. You want to drink them as teas. And then after you've done that, or that's part of your plan, the next step is to start to get rid of this congestion. You need decongestants. So decongestant, you can take teas, you can do steams, you can do baths, you can do gargles, you can have teas. You would work with elderberry, you would work with thyme. So elderberry and thyme tincture would be children's respiratory support to help clear congestion, lung congestion, sinus congestion, or children's healing herb bath, which you can make as a steam, a bath, and a gargle. in the subsequent, or in the other videos, related videos for caring for a cough, I go into great detail on how to do all those, so watch those videos. Clearing the congestion is essential. Then, after you've done that, the next thing is this person or yourself or this child is in a lot of pain and they're restless and they can't really sleep and they're hurting and they might be a little worked up, a little anxious because they're not used to feeling something like this. So you might want some calming, gentle nervines like Children's Tranquility that's blended with chamomile and catnip, because that's going to help relieve the tension and it's going to help them get the sleep they need, the healing power of sleep. We all understand how important that is. Those are all internal things. And now externally, we have our Earache Relief Oil. This is brand new. This is my first time to talk about Earache Relief Oil. I'm pretty excited to have this as a part of our children's wellness set. So Earache Relief Oil is intended to help relieve the pain and the infection and clear the mucus out of the ear. It's going to be blended with mullein flowers, coptis root, garlic bulb, and arnica flowers. Think of mullein flowers and arnica flowers as analgesics. They're incredibly potent and soothing analgesics. And when they come in contact, when they touch the inflamed tissues, it becomes vulnerary. It soothes, it coats, it protects, it calms that red irritation and pain. Then think about arnica. Another great thing about arnica is that it improves circulation. It improves blood flow. So you have this area, there's a bunch of congestion in there. If there's congestion, that means things are not clear, things are not flowing well, things are blocked up. So by improving blood flow to that area, you're bringing all these antibodies in your blood, and it's promoting and improving your body's own ability to protect and heal itself. Also, the strong antibiotic and antimicrobial nature of coptis root and garlic bulb can kill bacteria on contact. So it's really essential that these herbs touch the area that's infected to soothe it and to kill the bacteria. So this is an external treatment. I want to share just a few more things about this ear oil. You want to only drop about 3 to 5 drops in. The oil needs to be warm, not hot. You can either warm it up by putting it in a warm cup of water, or I know a lot of times I was getting ready for things and I would just stick it under my armpit while I would run around and do things and just let my body heat warm it up. Another thing that's important is when you're putting the ear drops in the ears, especially on a squirmy child, you kind of got to pull in and summon this Jedi skill in you to get it in, because you want to get the medicine, the herbs, touching the inflamed areas. At the same time, you don't want to contaminate this dropper. You don't want to put it into an infected ear and then put it back into the dropper and then put it into another ear and then treat another family member and another family member. It's really essential that you don't cross-contaminate. So if you feel like you're putting the drops in and you bump into them, it's okay. Just alcohol, swab it off, let it dry completely before you put it back in. Be really mindful of hygiene and no cross-contamination. Once you have the ear oil in, then go ahead and put a cotton ball in to keep it. And ideally that they're laying down as long as possible. So nighttime is usually the best time to put the ear oil in, because 2 reasons. The earache is worse at night. It's more frequent at night. It hurts worse. It's going to pop up more. And they're laying down longer. And so the longer you can get those herbs to touch that area, the more benefit you're going to receive. So you want to actually put herbs in both ears. Start with the affected area and then just a few in the other side, just to make sure you're going to eliminate this earache completely. once you have the ear oil in, then you can apply a hot compress. So hot compresses can be heating pads, hot water bottles. Shoot, get a sock, put some rice in it, tie the end, stick it in the microwave if you've got a heating pad. Also, in our cough video, I talked a lot about onion poultices. You can do that same sort of onion poultice on the ear to help draw out the infection and use a warm poultice there. Sometimes they'll let you do this, but a lot of times children won't let you do it. But if you can gently massage, a gentle lymph drain, massage drain down in their neck. And if they let you, you can massage from your elbow to your hand on the outside, your elbow to your hand on the child, like at least 20 times. That's a Chinese medicine stroke to help relieve the pain and help get things flowing and moving and lymph and circulation flowing. It's also real calming and helps them settle and helps them rest. Okay, let's talk a little bit more about some treatments and some closing thoughts. Well, so these are my natural herbal remedy approaches. But then we have the orthodox way. And the orthodox way to manage these infections are primarily going to be pain relief through Tylenol. It's going to be antibiotics. And then if it persists, it's going to be surgeries, which starts with tubes in your ears, and then, depending on the severity of the situation, more and more surgeries. So one thing is, none of those orthodox methods are going to work, and none of these natural methods are going to work until you remove the underlying cause. The most common underlying cause, I can't say it enough, is going to be food allergies or an allergen, like I said before, to smoke or to dust or to an animal. Until that's removed, your problem will not be solved. So I want to just mention that. And at the same time, I want to go back and give some props to, because sometimes antibiotics really are helpful and they are the right thing for certain people in certain situations. At the same time, we're going to continue the conversation of, we know how damaging overuse of antibiotics can be to your microbiome and to your overall immune health and the long-term ramifications that causes. Okay, so keep that in mind. And a couple of things just to keep in mind, I want to remind you at the very end of this, I have a whole long list of just like closing thoughts and little things to keep in mind. One is, I'm just going to restate, just because there's a ruptured eardrum doesn't mean it can't heal and you can't hear later in life. You probably can. However, prolonged chronic ear infections are serious and it can lead to hearing loss and deafness. So please pay attention to them right away. Earaches happen, like I said, mainly at night, and this is a common mistake or problem that I see, is that the child's up at night all night long with the ear infection, and then in the morning they're better, right? And so in the morning they're better, so then they go off to the playgroup, or they go off to the park, or they go to school. And then at night again they're screaming and they're crying because of the earache. So the earaches are worse at night. If they're up all night long screaming or fussing or crying, they're not okay to go to the playgroup. They're not okay to go to school. Just keep them home, keep them warm, don't let them be in the cold, keep their head covered, no wind, wetness, no swimming. Even when they're bathing, I want them to be in these herb baths. I want them to have these steams and gargles, but when they're bathing, put cotton in their ears so no moisture gets in their ears. Another thing is just being really mindful of clearing up the congestion right away. And another thing is we all know that breastfed babies are going to have a stronger immune system, and they're not going to have as many earaches. Partially is because of the immune enhancing antibodies that come through the breast milk, but also partially because of their jaw. They have to open their mouth really wide to get the areola and the nipple and to suck and to get the milk. They actually have to work for it, so they're using muscles in their jaw and their tongue. And that muscle movement and that jaw movement forms and helps them when they're developing their ear canals, and helps them establish correctly and be strong enough so that they can drain efficiently. So breastfeeding for the win here. Now, however, if you have to bottle feed, then in this moment you want to get rid of the dairy. And if you have to bottle feed, try not to lay them down flat on their back and bottle feeding, because what happens is the milk that they don't swallow right away gets into their sinuses, and once it gets into their sinuses, then that moisture gets trapped in there, then the bacteria grows, and then they have these prolonged and chronic ear infections from the position that they're in when they're bottle feeding. So sit them up a little bit, and then even maybe massage that area to get everything to flow. What else do I want to say? Oh, teaching children how to blow their nose instead of just wiping their nose. You always see the kids, they wipe their nose, but they don't blow it. Here's another little tricky thing. I am just going to say this. Right now, if your child does have an earache or ear infection, they don't want to blow their nose because they might blow their eardrum. But to prevent ear infections, blow your nose really well. Get all that drainage out. Teach them to spit and get out all that mucus and all that phlegm. And I've already mentioned, don't put things in the ear. Oh, and the only other thing I kind of wanted to talk about right now is to keep in mind, because we're talking about ear pain and earaches and ear infection. Sometimes there are moments when children have ear pain and they don't have an infection. And the classic moment is if they're traveling and they're in an airplane and they're going up in the airplane and their ears pop. They're not having an infection, right? At the same time, herbs can still be helpful in that situation. That's where you'd have some gentle nervines, again, the children's tranquility, to help them with the suddenness, because they're nervous about the pain and they're nervous about flying and they have to sit still. And so children's tranquility might be really helpful in that situation. So Earache Relief Oil is a component it's a part of a holistic approach to clearing out the fevers, clearing out the congestion, the cough, supporting the immune system, eliminating the allergens and eliminating the underlying causes. And with all this care and all this approach, these earaches probably, once your child gets to be past 5 and 6 years old, and they have well-established ear canals, they probably will be more of a thing of the past. I just want to remind you before we go, download the ebook, Herbs for Kids, and you're immediately signed up for the course. You can visit our website, Botanicals.com, to learn more about all of these products and all of the herbs. And if you're watching this anywhere but there, I want you to go there, because you'll have the rest of our Apothecary Wisdoms. You'll have all of our blogs and everything that we're doing. And so, my friends, as always, I want you to drink deep and walk in beauty. I'll see you next time.